Hi, welcome to another episode of Hot Takes. Now, the Health Secretary in Scotland, Neil Gray, that's not really his title, is it? The man who pretends to be the Health Secretary in Scotland, Neil Gray, because the real one, of course, is John Swinney. But he says that the public should be assured that the SNP is, quote, making progress on turning the NHS around. By making progress, he means not doing anything at all and hoping that nobody notices. But we do notice. We notice that the waiting lists are getting longer. We notice that cancer care is getting worse. We notice the increasing number of deaths of serious illness. We notice the car parks full of ambulances waiting, sometimes for 24 hours, to offload a patient into the A&E in order to be triaged. We see people waiting 48 or even 72 hours to try and get a bed after triage. It's not good, is it? But of course, we're now turning the corner. In a few more days, it's the end of summer and autumn will be upon us. And that's when, of course, it all starts getting a little bit worse. And then, of course, the winter. The winter is going to be horrendous. They are already talking about a winter collapse of the Scottish NHS. Last year was the worst one ever. This year is going to be worse. And there are many, many reasons. One of them, of course, is that you've got an idiot running the health service at the moment. A man who is so far out of his depth that he sits in his office stimming. He doesn't talk to anyone. He won't go to hospitals. He doesn't even like answering the phone. He has staff who do everything for him because he just cannot cope. This is the problem when you promote people who are not any good into positions where you need someone not just good, but exceptional. And I'm afraid Neil Gray falls very, very short of exceptional. He falls very, very short of adequate, let's be honest. But staff are being stretched beyond their limit. They are working shifts well beyond what I would consider the safety level for patient care. When you get someone who's done a 12-hour shift and then is asked to do a further 3 or 4 hours while dog-tired, loss of concentration, you misread things, you misplace things. You can quite easily overdose someone because you read 3.5 as 35, for example, because it's tiredness, and it's 2 o'clock in the morning and you should have gone home 6 hours ago. These things happen. You can't blame the nurses. This is not the fault of the nurses. Sure, they may be the one who make a mistake at the time, but it can't fall on them. They're the ones being pushed into it because there aren't enough people working in the hospital. Do you know that there's over 100,000 empty shifts? 100,000 shifts every year that are missed because of a lack of staff. So it's not in any one hospital, it's across the whole of the country, but 100,000 shifts. That tells me you need to hire a lot more people. 10,000 new nurses? I don't know if that's enough, but it would certainly make a big improvement, and you wouldn't be constantly overtiming the nurses that are there. I don't know if overtiming is a correct word, but it'll do. You understand what I mean, and that's good enough. Now, Gray has been defending his record as Health Secretary. God knows what he's doing to defend it, because there's no defence. It's indefensible. Everything has gotten worse since he's taken over. And I mean every single measure. By everything, every metric, it's got worse. Now, he said that, we're the ones with a plan. We're the ones that have demonstrated the plan is also working. Well, yeah, but if the plan is only to destroy the NHS and kill everyone, that then is a successful plan. But if the plan is to make the NHS better and cure people, then I'm sorry, Neil Gray, but no. Now, he says you've got a record number of hip and knee replacements delivered. Have you? Have you really? That's great. Hip and knees are brilliant. Let's say, even if it were true, and I don't believe it's true, but even if it were, that's not life-threatening. Cancer is. How's your cancer record? Oh, wait, don't want to talk about that, do you, Mr. Fail? Cancer rates are failing horrendously. The gap between seeing a GP and seeing an oncologist is longer than ever. People are going in with stage 2, and by the time they get seen and started treatment, it's stage 4. It's a death sentence. That's what cancer is in Scotland, because it just takes so long. As for midwives, dear heavens to Betsy, there is a massive shortage of midwives. They could hire 500 tomorrow and it still wouldn't be enough. Clearly, it's a fail. Clearly, whatever plan he thinks is going on in his head isn't working. And it doesn't matter how much money you pump in. If you don't have the right people controlling it, it's wasted. With the SNP, you can never have the right people controlling it because they're all blethering idiots. Thanks very much. Don't get ill. Hit subscribe.